Good morning, Hospital Board of Directors. It is a privilege to be standing here presenting before you on the topic of moral right to healthcare. It seems to be an easy topic to discuss if we all agree in everyone's equal right to health and life. But due to several constraints brought on by the Code of Ethics, resource allocation, and Stark Law, among others, the issue of moral right to healthcare becomes a more involved and complicated subject to consider. As the hospital's compliance officer, I have been charged to present to you this topic of moral right to healthcare. First, it would be beneficial to go back to the basic discussion of the Code of Ethics that we in the business of healthcare are obligated to keep in mind in making decisions regarding the health and well being of patients. The Code of Ethics guides and aligns our mission and vision to keep at the forefront the best interests of patients. Beneficence, non maleficence, autonomy, and justice are four principles healthcare providers and professionals are expected to practice. In the principle of beneficence, doing good to patients is the utmost goal. Our healthcare providers, along with all the allied healthcare professionals, are asked to do good by providing the best medical service based on their best clinical judgment. This is also the basis of charity works that is being provided when patients who come through our doors do not have the means to meet the financial obligation to pay for the service. According to Bastilius 2013, the positive duty imposed by the principle of beneficence requires that healthcare managers do everything they can to reasonably care for and benefit patients, employees, and others for whom the organization is or may be responsible. In the principle of non maleficence, it compels the provider to do no harm to patients or make any choices that is detrimental. Non-maleficence is the general duty to avoid causing harm to others, either directly or indirectly. It sometimes is necessary to risk harm to achieve a greater good or prevent a worse harm. Doing no harm can sometimes be a difficult choice that only the clinician is able to decide based on his extensive education, knowledge, and experience on the matter. But we trust that whenever they decide that the benefit of the patient is utmost in their minds. The principle of autonomy takes the choice of the patient to heart. Both beneficence and non maleficence can at times get complicated when the provider knows, based on clinical standpoint, how to best treat the patient, but the patient, exercising his patient right of autonomy, refuses the treatment or requests a different route. Based on the patient's assessment and informed consent, the right of self-determination must be honored. The principle grants the right to accept or reject recommended treatments, but decisions about the appropriateness and effectiveness are the domain of the physician. Upon verification of the patient's capacity to make informed consent, the provider is to honor what the patient decides what is appropriate treatment for him. In the justice principle, it is imperative that patients view the healthcare organization as fair. It is exemplified by the Aristotelian ideal that people in similar situations ought to be treated similarly, and people in different situations should be treated differently. A distinction is sometimes made between distributive justice, which refers to the allocation of resources, and procedural justice, or the fairness and transparency of the processes by which decisions are made. In distributive justice, the proper allocation of resources based on medical necessity is important, yet often difficult because of the limited resource. On the other, it is expected that the method by which these resources are allocated should be transparent. Again, this is difficult to do because every patient deserves the treatment they need, but not all will receive. In resource allocation, we are reminded that healthcare resources are not infinite, but in fact limited. Mick 2005, in her article, The Ethical Dilemma of Medical Futility, the case of Mr. X, she states, in a healthcare system in which rationing is inevitable, The concepts of utility and distributive justice easily can come into conflict with an individual's right to autonomy. When a patient's autonomous wishes are in conflict with the judgment and professional integrity or autonomy of the physician, and when the demand for care involves the use of costly resources, continuing futile treatment does not uphold the principle of justice. Society is not able to sustain every individual's unlimited demands on its resources. Futile treatment, she adds, is a matter of justice and accountability that requires consideration of the use of resources, the outcomes of consequences, and appropriate decision making capabilities. The sense of justice is satisfied when accountability is present, and whenever it is absent, an ethical conflict may result. Stark law ensures proper referral of services to other specialty providers where the referring provider has no vested interest in, which may be viewed as defrauding Medicare and Medicaid. According to Bostelius, Stark law governs physician referrals for Medicare and Medicaid reimbursed services in which the physician or close family member has a financial conflict of interest. This law was enacted to address overutilization of services, which causes healthcare costs to go up and causes diminished or lessened competition by other providers. The purpose is to prohibit improper referral relationships that can harm the federal healthcare programs and program beneficiaries. It includes 11 designated health services, including laboratory tests, physical or occupational therapy, imaging services, radiation treatment, home health care, pharmaceuticals, medical devices and supplies, and hospital services. Back to the topic of the moral right to health care, based on ethical principle of beneficence, non-maleficence, and justice, with resource allocation in mind, and rules and laws established by the government, we are led to believe that each one has a moral right to health care. The Patient Bill of Rights reminds us that the patient has the right to considerate and respectful care, be informed of conflicts of interest, and reasonable continuity of care, among others. I hope that this presentation provided some review of the moral right to health care, keeping in mind ethical principles, resource allocation, and government constraints on referral for government payers, as in the discussion of Stark Law. Thank you so much for your time and have a good day.